Ultrasound is a complex field of study where learning never ends. To gain the right knowledge and skills, hands-on training is required. This can be best provided in a simulator-based training that does not interfere with regulatory and live patient availability. Presenting GE's Trimester Scanning Workshop. A hands-on workshop on state-of-the-art simulator that gives highly realistic experience and true-to-life images. Expert guidance to give you personalized and engaged learning experience. A methodical approach to help you solve all your queries on trimester scanning. Preloaded cases and modules across various pathologies to experience entire spectrum of clinical scenarios. Personalized learning with a limited batch size.
I am happy that whatever theory has been inculcated in the agenda, the same can be shown practically. So when you do something, you will learn much better than when you're reading something or when you're seeing something. So it's all about doing it yourself. Now practically, if a doctor has to learn on a patient, you can't be searching for one plane for half an hour on a patient. That doesn't, it's not ethical, it doesn't make sense. But a simulator workshop, if a doctor wants to just get a BPD plane and the baby is moving, you can spend that much time trying to maneuver your, make your movements right to get that plane.
I have attended workshops of GE before. The difficulty was getting hands-on. So they had to go to some medical colleges, get hold of patients, availability of patients and availability of the kind of cases we want, and the time on which a patient can be worked upon. These were all the limiting factors for a workshop. Now that we have got a simile, which is really working beautiful, working on the simile, I think anybody who has not touched a probe can go confidently use a probe on a patient directly.
I learned TVS here only for first time, because till now I have not yet started TVS in my clinic.
The basic things like probe handling and all, they told us the complete technique of probe handling, some basic concepts about the machine. Presets was very useful. I always knew this zoom, gain, depth, but there are so many other things, and for what scan, which presets to be used.